We are going to take up several bills during the course of our meeting this afternoon. We don't have everyone here presenting their bills yet, so we also have a couple of presentations after or during the process, so we'll kind of intermingle that as members show up. Gina Boyle is here, Deputy Commissioner, Department of Social Services, who's going to speak to us, give us a budget briefing on their area. We also have Emily Griffey here from Voices for Virginia Children, who's going to talk about children's issues. And our last topic will be a brief overview of HHR member budget amendments from staff, which we have a lot of them, and some of y'all sitting here have requested a lot of them. So we're going to have our work cut out for us as we go this evening. Please note that anyone in the public today here to speak on any bills under consideration, you'll have to come up and use the microphone, and be sure to turn it on as you do, as I forgot to do as we began. And that's basically it, other than y'all are aware of we can't have people standing in here. You have to have a chair, and it looks like we've got our chairs filled up at the moment, so we're in good shape there. And unless anybody else, Janet, you have anything to add? Any member? Okay. We'll go ahead then. We do one of our, Jennifer, Senator McClellan, you do have a bill in front of us, so we'll go ahead and take that up first if you're ready for that.
I do, and I am, Mr. Chair. I have Senate Bill 469, which is a recommendation of the Joint Commission on Healthcare. It was a unanimous recommendation from the Commission as part of its study on health insurance affordability in the individual market. What the bill does is requires the health benefit exchange, which is currently being implemented based on legislation we passed a couple of years ago, to prepare an annual marketing plan that includes consumer outreach and navigator programs. What the Commission found in our study is that increased public awareness and assistance for applicants is a cost-effective way to increase enrollment in the individual market, reduce the number of uninsured, and add younger and healthy individuals into the marketplace. Nationally, more than half of those surveyed between the ages of 18 and 34 were unaware that they could qualify for financial assistance through the Affordable Care Act, and were unaware of their health insurance options. And by making, through this Navigator and Outreach program, it will help us to add the younger and healthier enrollees, which is one of the most effective ways to keep health insurance premiums low through the exchange. That is the bill. I've got some folks from the Joint Commission on Healthcare that can answer any questions. There is a budget amendment that goes along with this bill, and that's it.
Okay. All right. Is there, I think this bill will be in pretty good shape. Is there anybody here that came prepared, wanted to speak to it? Or anybody opposed to it? I wouldn't imagine anybody to actually be opposed to it, unless it'd be one of us up here. And actually, Senator McClellan, you, Senator Barker, and myself all thought this was such a good idea. We were all trying to take credit for it, but we all worked on this a couple years ago, and it's coming to fruition now. There is a suggestion for cost that could be, but I've been informed by staff that we could pass this and then make a decision about how much money we want to put into it, if any, in this current budget. So that's my understanding. What's the pleasure of the committee?
Will we recommend reporting?
Second.
Motion properly supported that we report the bill that is Senate Bill 46, rather recommend reporting to the full committee, Senate Bill 469. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? All right, the bill is recommended to be reported. Thank you, Senator McClellan. We don't have other members now, so I think what we'll do is get into presentations. And Jenna, I thought that was you over there with the mask. I hadn't seen you in a while. Good to have you here today.
Okay, just doing a test. You can hear me okay with the mask on, right? Good afternoon, Gina Boyle, Deputy Commissioner for Policy and Administration at the Department of Social Services. And I do want to recognize to my left here is several members of our executive team, Roland Rivera, who's our Chief Technology Officer, Kristen Zagar, who's our Deputy Commissioner for Human Services, and our budget team, Ida Witherspoon and Kelly Zioli over here. So good people to know if you and may need to phone a friend. So what I'm going to do is I've organized this presentation into 4 parts in an effort to provide some context to the proposed budget. I'll start with a brief overview of the department and the social services system, followed by some background on the department's budget. I also want to discuss the impact of COVID-19 on families in Virginia and the federal money we've been allotted as part of the various federal stimulus packages through our programs. And then I'll proceed to talk about the governor's proposed biennial budget for DSS. Virginia operates under a state-supervised, locally administered social services system, so the majority of services provided directly to citizens of the Commonwealth in your localities are done through the 120 local Department of Social Services, and there are approximately 9,000 employees. So unlike the model of the health department, where they're state employees, our local department staff at social services are local government employees, and they are governed by a local governing board. That being said, we do support the system through our IT systems, training, and our other programs. However, there are a number of programs that our department administers at the state level. Our child support enforcement program has long been considered a leader in collections of child support obligations, innovation, and cost effectiveness. Our licensing division inspects licenses and works with over 7,000 adult and child facilities statewide. We provide refugee resettlement and repatriation services through the Office of New Americans. Our agency is responsible for state emergency shelter efforts when local governments cannot provide shelter. And in 2020, we also began administering a new benefit called the Pandemic or PEBT benefit, which was developed to ensure children could still receive food assistance when schools were closed. And then finally, we also run the statewide Adult and Child Protective Services hotline and perform background checks for licensed entities and run the national community service programs like AmeriCorps. So that's going to be relevant for when you see some of this federal stimulus funding from COVID. Most social services system spending occurs outside of the DSS appropriation and goes directly to families and eventually local economies. So I think this slide really shows you the impact that our programs have on the economy in Virginia overall and locally. So the statewide economic impact from department funding and programs for which the department determines eligibility was almost $19 billion in FY21. This slide reflects the department's general fund spending. The first 3 categories in our child support program reflect the state's portion of funding that is accompanied by a federal or local match. And the total general fund spending for FY21 was a little more than $423 million. The DSS budget is one of the more complex state agency budgets. Funding sources include state, special, and local funds. The local funds are not appropriated at the state level but contribute significantly to service delivery and service matching funds for accessing federal grants and funds. Federal funds are a major component of the social services system financing and contribute more than 1/3 to total department funding. The federal funds are spread over approximately 3 dozen federal grant programs. There is a high degree of regulation on most of these funds, which accounts for most of the budget complexity. And we have the COVID stimulus funds separately on this slide. So this year in FY21, they made up 9% of our total budget. And so that's aside from the general federal funds that we got, which is pretty significant. On this slide, I want to provide a snapshot of the economic impact that COVID had on families in Virginia and in turn our benefit programs. As you can see, there are significant increases in almost every category. Our local staff have been able to keep up with these significant increases due to a number of flexibilities that the federal government has afforded us as part of the federal public health emergency. Example, so in the Medicaid program, locals were unable to close out any Medicaid cases while the public health emergency is still in effect at the federal level, which it still is, and now is projected to be through April 16th. This meant that they were concentrating on the increase in new applications and not doing the renewals yet. But that does also mean there's a backlog. So that's something we need to address going forward. And then also in SNAP, the federal government waived the requirement for a face-to-face interview while the public health emergency is in effect. So all of these flexibilities will eventually expire, and we are sort of planning for how those will newly be, so the renewals and the new face-to-face requirement comes back into effect. Overall, our funding award total across all the federal stimulus packages, there were 3 rounds, so you will hear people talk about CARES, CURSA, and ARPA. Our total was around $398 million. We've broken these into areas of economic support programs for families. These are mostly our benefit programs, family services, and community and volunteer programs. Not included in this total is stimulus funding transferred from DHCD for emergency rental assistance and from DARS for adult services and adult protective services. All of these funds have gone through that process that you set up in the special session, and where we provided you with a detailed memo, and you had a certain number of days to respond if you had any concerns. So you do have detailed memos on all these things, but I'm just going to give you a high level of what we did with these funds, what we've been doing with these funds. So the largest portion of those funds is in the area of economic supports for families. So through the child care block grant, this reflects the portion of the funding that came to us prior to the child care program going over to the Department of Education. The majority of this funding went to incentive grants for providers and funding for school-age child care. DSS also received $85 million in coronavirus relief funds from the CARES Act. $75 million of that was used for incentive grants for child care providers, and $7.6 million for a contract with the food banks. In our TANF program, we received $15.7 million, and the majority of this funding was used to provide a one-time payment of $905 to our TANF households. I mentioned pandemic EBT earlier. This expands SNAP to those who qualify for free or reduced lunch through the schools. We have, there is a significant amount of money flowing, although in 2020, FY21, it was $14.3 million. There's a lot more coming in this fiscal year. In the SNAP program, the money is specifically for admin. The majority of the funding is helping to offset the increased general fund costs due to higher SNAP effort at local departments that I just mentioned. And we also, through the ARPA, are going to have to stand up a new benefit program and a water assistance program. So this will be similar to our energy assistance program, also known as LIHEAP, but it is a new program to provide support for arrearages for water bills, as well as coverage of water bills going forward. And that we have to stand up at least the first part of it in April of this year. And then in terms of our energy assistance, this money funded supplemental payments to households, increasing the cooling benefit amount last summer and increasing eligibility for the program from 130 to 150 FPL. In terms of the family services money, there was a total of $33.7 million in federal stimulus money in this area. This money was allocated to domestic violence programs for housing assistance, alternative sheltering, and COVID-related supplies and testing. This, in terms of child welfare, there was money in CARES that we used mainly for technology, so data enhancements and contract services. We got some more money for child abuse prevention and treatment, which we're going to be using to focus on prevention. And also through our community-based child abuse prevention grant, we got some money in the area of promoting safe and stable families, and this will be to provide community-based family support, family preservation, and reunification and adoption promotion. Okay, and then finally, for COVID funding in the area of community and volunteer services, there was a total of $22 million in this category. There was a category of funding for newcomer services to provide agencies with funding that provide direct services for refugees. This became really important when we were asked to stand up a unit at Dulles when the evacuees from Afghanistan came through. We had a lot of activities in that area. And then in the community services block grant, there was more money to support community action agencies at the local level, and we also received some AmeriCorps ARPA funding to increase member living allowances and the cash match.
Gina,
Yeah.
this seems like a good spot to stop and let the two senators who are here do their bills,
Yes,
and then
ma'am.
we'll come back to you.
Yes, ma'am.
Finish, okay. Senator Favola. Okay, now.
Thank you. Oh, hi, thank you. I would like to speak to Senate Bill 56, and I believe there's an amendment, and I would like to have that amendment adopted. Thank you.
Is it a substitute then rather than line item?
It is a substitute.
Okay.
Yes, we rearranged some paragraphs.
Is there a second to adopt the substitute? All those in favor say aye. Aye. Any opposed?
Thank you, Mr. Chairman. What this bill does is it creates a true foster care prevention program. So it states that if a child is placed voluntarily with a relative or victim kin after November 1st, 2020, that household, and now a victim kin would qualify, they would be able to apply for assistance. Some would be eligible for federal assistance, and some would be eligible for state assistance. The total amount would not exceed what the Title 4E foster care payment would be on a monthly basis. The purpose of this bill is to ensure that children who would otherwise be placed in foster care have an opportunity to go with a relative or loved one, not be placed into the system, but allow that relative and loved one to really provide for them and to get access to resources, because it is expensive to raise a child. There is language in here that if the relative or victim kin expects to be the custodian of this child for a long-term basis, then they should be encouraged to go for some kind of custody agreement before a JDR court, but that's not a requirement. And that's the extent of the bill. It's a good bill.
Senator Favola, they're all good bills, aren't they?
They're wonderful bills, yeah.
What was the major change in the substitute?
We rearranged some paragraphs, and the major change was in the bill that was heard before Rehab and Social Services. We had language that would have required the relative or victim kin to go before JDR judge and have some kind of plan or custody agreement. We removed that requirement, and now it's merely encouraging the relative or victim kin to get a custody agreement if they're going to have the child on a long-term basis. Because we have a fair number of relatives who may not ever go for the custody agreement, and we didn't want to exclude that pool. That's the major difference. And then we did some rearranging of paragraphs.
Okay, and I apologize, I slipped out for a moment, I think I'm not quite up to speed. Is the fiscal impact, is that included in the introduced budget?
Well, there is a fiscal impact, and I did put a budget amendment in. It's going to depend on how much money actually is available. Some families will be eligible for TANF, some families will not. So it's hard to say, but the fiscal impact that's part of the budget here has, you can see from fiscal year 2023 to 2029, it does have an impact. 9 million, and then it goes up. So.
Is there anything to change that, or is that pretty solidly what we're expecting?
I mean, we would have to notify DSS to see if that changes the fiscal impact.
But, and as you notice, we limited it to November 1st, 2020.
Right. Yeah, it's taking them through this early in the process sometimes is an issue when this is larger number. Is this in planning where this has been anticipated in the spreadsheet? Okay.
Mr. Chairman, and since we have some folks from DSS here, maybe they could comment as well. But if you remember that we had funded maintenance payments to relatives through TANF, about $8.5 million per year. And in the introduced budget, they actually switched that over to general fund. So one thought is that that this more codifies that. So I would probably need DSS to kind of confirm that. That's $8.5 million per year. So if that could be applied to this program, then your delta to the fiscal impact is about $2.2 million general fund over the biennium.
Someone from social services want to speak to that? Jen?
Gina Boyle from the Department of Social Services. Yes, so Mike, it is exactly as Mike explained it. So we currently provide these relatives payments now, but it's accounted for in the TANF program. What I'm about to explain to you is in the outer years of the TANF program, we're approaching that point where those surplus monies are dwindling. And so what you'll see is by FY25, our TANF budget is completely allotted. So that's why the change from the TANF, moving from TANF to the general fund to account for some of the TANF balances. But Mike is right. So if you subtracted that 8.5 million that's in there, it would be a differential cost.
The other question, is this scalable so that it would be dependent on the budget number we adopt?
Yeah, I mean, obviously, we would have to work within the appropriation we would be given, and I think Senator Favola, we had talked about that and putting language that it was there as long as the money was available or something like that. Yeah.
Okay, so it would still be left to final budget decision on the amount that we would fund rather than, okay? All right, what's the pleasure of the committee? Further questions or action? Anyone here to speak to the bill? One word, yes.
Members of the committee, Allison Gilbreth with Voices for Virginia's Children. We want to lend our support to the bill and thank Senator Favola for her hard work on working on these issues over the year and hope that you will support the bill as well. Thank you.
Okay, since we have the flexibility with TANF, which hasn't been exhausted yet, we deal with the present, not 2025 currently, although we got to take that into account eventually, don't we?
Yeah.
And it's scalable. We perhaps could go ahead and entertain it without a clause, I suppose. Anyone here to speak in opposition? Nobody speaks in opposition to good causes, do they? Motion properly supported to report the bill. All those in favor signify by saying aye.
Aye.
Any opposed? All right, we will recommend reporting.
My goodness, I'm
Senator.
so happy. Thank you.
Yes. Well, we'll be happy if we have enough money to cover it. Yeah.
It's scalable.
Okay,
Senator Edwards is here.
Senator Edwards. All right.
We had a joint subcommittee to study barrier farms. We've had a joint subcommittee for the last year or two to study barrier crimes and criminal history records checks. There are 16 states that have similar types of processes, and
what the bill does basically is to very, very few barrier crimes are deleted, but the bulk of it is that certain agencies could have a waiver process for individuals who've been convicted of barrier crimes that seek to serve, and their employer wants them to serve in a certain positions that are now they're barred for life for seeking these positions. That's the trouble with the barrier crimes. You're barred. It's a issue of not having. I think it's a constitutional issue as well, that you can't work in certain areas because for life. And so this gives you a waiver process. As I say, there are 16 states that have something similar to this, and it would require the 4 agencies, the Department of Behavioral Health, the Department of Education, the Department of Health, and the Department of Social Services to set up a system like these 16 other states are doing to help people be relieved of their barrier crimes, at least to give a waiver of the barrier crimes so they could actually work in these positions. That's basically what it does, and there's a fiscal impact in order to set it up, and also the state police says it's not going to have any impact on them, but the other agencies say they need, the Department of Behavioral Health requires 3 positions, the Department of Social Services, 3 positions, Department of Education, 3 positions, and the Department of Health, 6 positions. So this should be. I'm sorry, what did you say? Yeah.
Okay. Senator Edwards, I think it's probably been 6 years ago or so. There was, due to a fact that there was a couple that wanted to be foster care parents, and there was a barrier crime in place at that time, that it appeared the director of the Department of Social Services, Commissioner, would be able to grant the waiver. And in the process, they decided at that time she didn't have the authority, so we completely rewrote the barrier crime section. You're not rewriting the barrier crime section, you're just singling out certain current barrier crimes that would be eligible for this waiver process?
Well, no, there are some barrier crimes we wouldn't use because it didn't make any sense. But the other barrier crimes would, the individual who's been convicted of certain crimes could ask these agencies to have a process to look at whether or not they could qualify for the position. Of course, the employer would have to agree, and the employer would know what's going on. But the idea would be to have a process where there could be a waiver, so they could get the job. And I don't know if we're rewriting that or not, but I'm not sure how I would characterize that.
Okay.
But
Senator Edwards, so is there, and maybe Senator Favola, since she's here, her committee heard this, but is there a certain list that would be eligible for this waiver process, or all of them are subject?
Yes, no. There are barrier crimes with regard to each agency. Behavioral health has a list. Healthcare has a list.
Right.
Education has a list. The Department of Social Services has a list. And so it's only those where a person's convicted in this category. Right now, there's no process for waiver. And 16 other states do have a waiver process. So the idea is to have a waiver so a person could get a job in healthcare, for example, nursing homes, whatever it happens to be, as long as and there would be a process if it was denied. The agency would have to explain why they're not going to get the job. We're not giving a waiver in that particular situation. As I say, state police would be involved as well, but state police says there's no fiscal impact for them. But
yeah, Mr. Chair, I was just having a sidebar conversation over here with Mike Tweedy asking about the process, and I think everybody on the committee is aware we all have, as constituent service matters, people reach out to us and talk about this process of background checks. And I was just inquiring of him whether he thought this would create an immediate issue. And he wanted, well, I just thought I would mention to the committee, this does not go into effect until January 1st of 2025.
That's right.
Because I hadn't read ahead that far, and I just thought I would mention that to the committee. It is relevant. But I would say, given the huge shortages we have in staffing, I think it's probably warranted. But I would also say that I am so sad and frustrated by the process of the background checks and how long institutions and families and everybody has to wait for this process. And so I know that isn't relevant to your bill, but I just had to say that. Thank you, Mr. Chair.
Okay. Before we take action, or is there anyone here to speak in favor of the bill?
Like I said, we had a pretty involved study, and people spoke in favor of the bill.
Since we are in subcommittee, we'll hear brief
Yeah.
testimony.
I'll be very brief. Committee, Allison Gilbreth, Voices for Virginia's Children. I can only speak to the items on foster care, but we are in strong support of those bills. They are especially impactful for kinship families as they're going through the process of trying to foster children. Thank you.
Mr. Chairman, members of the committee, Becky Bowers-Lanier, and I'm representing both the Virginia Association of Community Services Boards and the Substance Abuse Addiction Recovery Alliance. We have a workforce problem. I heard Senator Deed say that. Many of us have been saying that, and so Senator Vogel just said it too. And in concept, this is a very complicated process that Senator Edwards has brought forward. We support anything that can help to get more people in the workforce. In the Substance Abuse Addiction Recovery Alliance, we've got peer recovery specialists whose addiction problems was associated with the crimes they committed, and they cannot work in the field. And we know that peer recovery specialists offer tremendous services for people who are recovering. They can work in the Department of Corrections without that, but they cannot work in many of the other places. And so we've got to do something about this.
Thank you. Senator Deeds, you had, we're about to offer an amendment. I would note that it looks like in this current biennial budget, it's a minimum amount, and in fiscal year 25, a larger amount based on the time.
Yeah, Mr. Chairman, just to clarify, so the bill doesn't take effect till the main provisions of it with the waiver processes and stuff. I think part of that is to give the state police, other agencies time to kind of work on stuff. The foster care and adoptive barrier crimes, that part takes effect on July 1. But that piece doesn't have the fiscal impact. That piece is basically just conforming our barrier crimes for foster care and adoption to the federal level. So basically, the only fiscal impact in this biennium, according to the fiscal impact statement, is about $36,000 in fiscal year 24, and it's really for the Department for Behavioral Health to basically develop regulations for implementation of the next biennium. So once it's in effect, you basically would have about $1.7 million per year in fiscal year 25 and on for all the for the agencies, behavioral health, social services, education, and the health department to all establish positions and stuff for the waiver processes for those agencies.
Okay. What's the pleasure of the committee? Is there anyone here speaking in opposition? Seeing none, what's the pleasure of the committee? Everybody comfortable without putting the next proposal?
I'm comfortable with that. I'd like, do we have a list somewhere of the codes, the crimes that are represented by these code sections?
The committee came up with a list. One of the problems is not in the codes. They're all over the darn place. They're scattered. And I've, over the years, have tried to at least come up with some logic to it in different categories. And right now, but we have that information, but in the code, it's not. It's all over the place.
Mr. Chair, Legislative Services.
Vogel.
Thank you. Legislative Services has it. I'm told Lynn can give it to us.
I think they do. In fact, David May of your committee, Barbara, Senator Vavola, worked on that extensively back 6 years ago.
Right. This, Senator Edwards, your bill came out of a study committee that had spent nearly 2 years looking at barrier crimes and how we could appropriately relax some of those barrier crimes under certain conditions so we could actually help in positions that perhaps somebody's experienced and as a former drug offender would be helpful.
Well, one thing that's worth mentioning, the people that really want it are, for example, in certain agencies dealing with drug-addicted people who are former drug, they are better at communicating with people who do have addictions to help them with their problems because they're former addicted people. But right now, they can't do anything.
Okay. We had a motion. Was there a second?
There was a second.
Okay. All right, any further discussion then? Hearing none, all those in favor of recommending reporting the bill to the full committee signify by saying aye. Aye. Any opposed? All right, we recommend it reported.
Thank you, appreciate it. Thanks.
I think we've cleared the deck, Ken.
It was indeed a good stopping point because now I'm going to go into the.
And while we're stopped, you, on the previous page, you had talked about your responsibilities and funding that y'all had for
COVID.
the immigrants.
Yeah.
And the immigrant program. Was that all federally funded? Or
Yes. Yes, sir.
Okay.
This is through the Federal Office of Refugee Resettlement.
Okay.
Okay, so now we're going to get into the proposed budget. We've broken these into a couple of different categories. First, investing in IT systems, economic recovery and support, supporting safe, strong families, equity, efficiency, and compliance. And we also have a couple of ARPA items that we received our federal award letter after you took them up in the special session. So we're going through the process of getting those approved. And then we have some technical adjustments. And today I'm just going to concentrate on the more substantive items for you all. Okay, so as you all are well aware, we have several outdated legacy IT systems that we need to replace with modern technology. The proposed budget includes funding for a new child welfare information system, which you guys have heard called CWIS, that we must build in order to be compliant with the federal government's regulations. And also, we are the only state in the country still completing this work on a largely paper-based system, which comes with its own costly implications. We also need to replace the Virginia Case Management System, which is our current eligibility and enrollment system for Medicaid, SNAP, energy assistance, etc., across the board. The contract that we currently have to run this system expires at the end of 2024, and we do not, under the law, have the option to extend it. We also need to replace our outdated legacy child support information system, which can be done utilizing 100% federal funds. Finally, the last item you see here is probably the most urgent. So I know that you guys have heard from your local departments that they often have difficulty accessing the system or there's latency issues. So this is most often due to barriers to connecting to the network. And the proposed budget dedicates those general ARPA funds, a certain amount of those general ARPA funds, to upgrade the mission-critical infrastructure in order to do that and solve this problem. So obviously this is a lot of funding, and these are several big, major systems. So I know your question is probably, are you really going to be able to implement this? Are you really going to be able to spend the money in this time frame? So historically, we have built our IT systems in silos to accomplish core components of a program, and this has been problematic for a number of reasons, including that we cannot look across those data systems to pull out data that you guys could use to make more informed decisions. You often ask us for data that we just can't get across because our systems don't talk to each other. And we have taken a number of steps over the last several years to bring our IT governance and strategy up to industry standards. So we will not be building these systems in silos as standalone systems. We're going to employ a new strategy that's called low-code, no-code platform. This means we'll be building components that are based on functionality. So an example would be almost all of these programs have a payment component. We'll build a module that can exist for functionality of payment. We'll be able to use it, reuse it as we move to the functionality across programs. And I also think it's important for you to hear that we will be participating in a full competitive procurement process to select our vendors to build these components.
Question on that. Will that present an opportunity for some potential privatization in the eligibility area?
So for determining eligibility, so it's our local departments of social services that are the eligibility that provide. There will be an opportunity to do things like new technology, like AI technology, to build in to help with what are now very much manual processes for eligibility and enrollment. So I think it will present a possibility for that.
Mr. Chairman? I've been around here long enough to have gone through several changes in IT, and they've all been basically a disaster for the clients, starting back 30-some years ago with the first one on child support enforcement. So color me skeptical. And
Understood.
I know we need to upgrade, but I would like to know what kind of redundancies will there be during the process so the whole system doesn't collapse.
Yeah, I'd recommend we can sit with the members, any members who would like a full briefing on sort of what I was talking about with our IT governance and strategy. We've done a whole total transformation in the department to address this very issue, and we are aware of the historical implications.
We're kind of in a holding pattern right now because we can't disenroll, and so y'all.
That's right.
We need to come up with something sufficient.
Yes. Okay, any other questions on the IT systems piece? So clearly we will get with you all for some deeper, detailed briefings on that. The next sort of category is in our benefit programs to promote economic recovery and support for children and families. So there is a 5% increase for foster care and adoption payments. The proposed budget allocates money from the new percentage of income payment program, PIP, which is an additional energy assistance benefit. There is appropriation to account for the 5% increase in the local Department of Social Services raises that's in the proposed budget. And then there is some money for contractors to expand our outreach initiatives in SNAP to vulnerable individuals and communities. So it's estimated that about 68,000 elderly individuals would benefit from this outreach, and also estimated that 65% of eligible working families in Virginia are served by SNAP. So we have, some more outreach could get us to reach those populations. We also have some adjustments in TANF funding. So I made reference to this earlier, but we need to make some adjustments in the balance sheet as we are approaching a spend down of the surplus that we have enjoyed for many years. And so I mentioned the relative payments and the switch from TANF to the general fund spending. There are a couple of other adjustments, including reducing the appropriation due to lower spending for the VIEW program, caseload reserve. There's some reductions in grants for community education and training. And then there are a couple of items that we removed because they were related to the pandemic and funding for that. So you will see that in the TANF balance sheet. There are several items in the area of family services aimed at supporting safe and strong families. There is funding for fidelity monitoring, evaluation of evidence-based program prevention for the Family First Prevention Services Act. This is one of the things that the federal government requires us to do, which basically measures the outcomes in the new law to ensure that that they are the outcomes that we're looking for. There's also an item that restores TANF funds for healthy families. So with a split appropriation, there were administrative and procurement issues in the Healthy Families program, and the total funding for Healthy Families does not change. This amendment just consolidates the appropriation at VDSS. There is an increase in money for the Sexual and Domestic Violence Prevention Fund, which would bring the total amount of the funding to $2 million. General funds, and this will support up to 11 sexual violence prevention initiatives and 11 domestic violence prevention initiatives. Finally, there is money to fund mandated child welfare investments. So we must reinvest reinvest state savings from increasing adoptions into approved post-adoption and other child welfare activities. In the area of equity, there is money in the proposed budget to create a public benefit navigator pilot program to award competitive grants to immigrant and refugee serving organizations. This would provide case management to limited proficiency English speaking individuals for help with applying for public services, and also help with legal services, healthcare, housing, education, and employment. There is a budget item to increase the minimum wage to comply with the new law. And there's also a language only in our section dealing with the Criminal Justice Diversion Program Task Force. There was this would, again, language only, create a working group responsible for studying effective types of diversion tools for use in local criminal diversion programs. And then one thing to note in sort of efficiency and compliance, there is funding, general funds to account for a 5% increase for our adult licensing program staff. So this is to correct an error when when half of that program or a substantial portion went over to DOE for the child care licensing. We had to backfill some general fund money for our adult licensing program, and it didn't account for the 5% increase in salaries. And then finally, there is also some funding for us to reevaluate state shelter sites on a rotating basis, which is part of the Commonwealth Emergency Shelter Plan. There are two items that are ARPA awards that were not included in Chapter 1 due to the timing of when we received the federal funding award. So this appropriation is being requested through the full GA session process. I do also want to mention a piece of legislation, not because it has a fiscal impact, but because if you don't pass it this year, we will have a major fiscal impact from our federal child support program. So this is House Bill 572 and Senate Bill 348, which is being carried by Senator Surville. And this legislation is our agency legislation, which would change Virginia law to no longer treat incarceration as voluntary unemployment when determining ability to pay and establishing or reviewing a child support order. So this is needed to comply with federal regulations that were passed in 2016. We have until January 1st, 2023 to comply, or we will lose our federal portion of the child support program, which is $76 million and is 66% of our overall support in this program. So it's a pretty big deal to us. So just wanted to flag that for you. It's kind of a situation that's weird because the bill itself doesn't have a fiscal impact, but if you don't pass it, there will be one. Okay, and that is the overview, and I'd be happy to take questions.
Any questions? Okay.
Thank you.
Thank you very much for your presentation. We'll take you right now.
Thank you.
Senate Bill 231 is what I have for your consideration.
Okay.
And so what we currently provide some Virginians with very significant needs are 3 different funds that they're able to access for themselves, each with $5,000, one for assistive technology, one for environmental modifications, and one for electronic home-based supports. And there have been several folks that we've heard from, especially during the 2021 virtual supports work group, that the $5,000 is not for assistive technology is not enough to get what they'd want. But we're not asking for that fund to be increased. What we're asking for is, instead of having the 3 separate funds all have the $5,000 cap, to just make it one with a $15,000 cap, and that way, instead of having the $5,000 sort of arbitrarily divided up, they can use it their household can use what's best for the individual. And I've got some folks here that can give you more, can articulate more of the actual experience of what it's like for folks that are trying to utilize these funds to help their household.
Okay. We'll hear that now.
Hello. Hi, Tanya Milling, Executive Director at the ARC of Virginia. Yeah, absolutely. We're grateful to Senator Suderline. This is an important plan so that we can increase access for people. Right now, it's about very limited buying power. $5,000 cannot buy much when it comes to any of the three things that the Senator mentioned. Whereas if that's combined and you would still only be able to spend that one amount, you could just choose the area that works for your life. So that may be getting a ramp at your home that $5,000 wouldn't cover. It would cost $8,000. And I think this is why one of the things we've seen is that it's so underutilized is because there's no buying power for the individual person. So with this opens up tremendous access. Thank you.
Okay, thank you. Questions?
Oh, I can tell.
Oh, no, I'm sorry. It was a question, I guess, for
Okay, thank you.
either. I'm sorry.
Although I'm happy to be supportive and sit right. No, I'm kidding. Thank you.
I'm struggling to figure out why it has such a high cost. Is it?
Madam Chair, so I think, the original fiscal impact statement kind of talks about, that was before the amendment. So the original was just for the 3 DD waivers. So the amendment adds the CCC plus waiver, which is what used to be the elderly and disabled waiver years ago. So that kind of, there's over, the DD waivers have 15,000 people on them. The CCC plus waiver adds over 30,000 more. So that increased that fiscal impact. I think the fiscal impact, which is, there's some uncertainty, is related to the fact that, like Tanya talked about, and Senator Suderline, that there's an access problem, that like if you're making an environmental modification to your home, $5,000 is not sufficient, so you don't do anything.
Right.
But if you can now spend $15,000, the expectation is that these services will be utilized more than they are now. So that's where the fiscal impact comes from, basically, is the expectation that you're going to see a lot more individuals use the services, which is certainly the intention of the services, is to provide access to them. But the issue is, though, but for you all to know, is that it likely, if utilization increases dramatically, that is a substantial cost that is not currently budgeted in the Medicaid program.
So, yeah, I was not picking up on the education and health amendment that was made. So, yes, there is a significant projected fiscal impact here. So, do we have other people to speak to this?
I'm Terry Morgan with the Virginia Board for People with Disabilities. Very happy to be here with you all today. We really see this bill as having a significant positive impact on people with disabilities, people who receive waiver services. The opportunity to have greater autonomy and independence and greater success living in the community can be achieved through access to these funds in a different way, combining the caps where people can make the choice of what they need to stay in their home, what they need to stay in their community. Technology has changed significantly over the past 5 years, let alone even just the past year, and the supports people need to live more independently in their homes without staff supports through electronic home-based supports are significant. So we're really at a time when technology has become more compatible with individuals' desires and choices to live independently. And I would also just like to say that With these services, if you're in the waiver, you still have to be found eligible for the service. It's not open to anybody in the waiver who can access these services. You have to be found to have a clinical need. It has to be determined appropriate. It has to be authorized. And that's the reason that some people in these waivers don't use these services, because they're not found eligible for them. So there's just a portion of people who in the waiver who are actually eligible for these services within those waivers. It's not the whole waiver population. Thank you.
Okay, additional, anyone else to speak to this?
Good afternoon, Karen Tefelsky, Executive Director, Virginia Access. Just want to echo everything Terry said, so I'm not repetitive because of time. And I thank the Senator for having this bill. What's interesting, the individual silos of $5,000 have been there since day one. It's never been changed. And so we were trying to figure out a way to give more flexibility so people could live more independently without changing sort of the makeup of the funds, but allowing that flexibility. So we were shocked when we saw it anywhere between 1.5 million and 50-something million dollars. I think we all fell off our chairs, quite frankly.
Okay. Go ahead.
Yeah, thank you. Looking at the FIS, it does say, like Karen said, a really broad range, but I think it says for demonstration purposes only. I did call to speak with the staff that created it, because they could only go on a set of assumptions.
Right.
Like if it went from the 5% utilization to 50% utilization, that's merely a demonstration. It is not going to go, I don't think anyone would believe that it would go from 5% to 50% in this year. In fact, DMAS has shared that they had some things administratively that they would need to do naturally to set this up. So we might be looking at increased utilization in the second year. Either way, I think that jump to think it could grow 10 times is not is not a potential when you think about having to demonstrate and justify the cost that each person would need to do. Thank you.
Now, it seems like we should be able to control the cost somehow in the budget. There's a pilot, because I can understand, it's a good policy to have, but I'm not sure how to address it at this moment. Unless we do put a financial contingency or, no, just don't know. What's your thought, Janet? You got?
Well, my thoughts got really swayed a couple years ago when I was in a wheelchair for several months. And I have a whole different perspective. I think we need to open access for people and let them.
And I agree with the policy. Go ahead.
If not now, when?
Yeah. Is there some way we can control the upper limits here in terms of controlling?
I'm not helping.
If we have this policy.
Something we can think of. I mean,
Come up with a.
Mr. Chair.
It seems to me that the only thing you could do is put a pilot project somewhere.
Mhm.
Have a pilot project of so many X number of recipients or a geographic area, and then you could figure out how much it could cost.
Mhm. Okay. So, were you like that?
Mr. Chair, I was simply going to offer something similar. I just also, thinking out loud, I find it hard to believe that it would be oversubscribed to that degree, especially if people aren't aware of it. I'm not certain that you're going to roll it out and spend money to advertise. And I mean, maybe I'm wrong about how it works, and maybe it would be. I don't know. But the goal is to actually have an impact on people's lives and give them the independence they need. And I'm a huge fan of the bill, and I'd like us to pass the bill, but with as little of a with as few constraints as possible within the budget.
Okay. Well, it seemed like if we do, Senator McCall?
Yeah, I was just going to say, I mean, right now, theoretically, anyone could use the maximum of $15,000 across the three funds anyway.
Right.
So if there is a potential that there would be increased utilization, theoretically, that potential exists now.
Right.
So if we weren't prepared to go to the maximum amount across all three services, we should have lowered the cap, which none of us want to do. So I'm willing to take the risk of increased utilization, because theoretically we should have budgeted to assume people would be utilizing the full cap anyway.
Well, I can see that this methodology versus 5,000 in three different pots could cause a significant increase. It's like if somebody needs 2 crutches and you only give them one, well, they're not going to use one. But if they need the full array of services, and that makes them whole, and that's a good thing, I'm not suggesting it isn't, then it could be significant. I would think if we pass this, we ought to have some kind of a commitment to ourselves that we're going to try to address in the budget, some language to kind of control the upper limits of what we're exposed to. Does that seem reasonable? And I don't know this moment how we would do that, but
Mr. Chair, other than the individual bucket caps and the 15,000 across all 3 buckets, what limitations do we have now on the number of people that can utilize this?
Senator McClellan, I would only suggest it's just our experience that it's not busting the budget, and the projections here is that potentially could, if it goes as being suggested here. I'm not saying it is, but I think we somehow need to, as a security measure, put something out there so that we don't go to 55 million if that's possible. And I'm not suggesting that wouldn't be a good thing. That would be a good thing if we met unmet need, with those services. What's the pleasure of the committee? Y'all want to advance the bill, and then we'll.
Yeah.
Okay.
We can recommend report, and then between now and the time it comes before the full committee, maybe we'll have more information.
Okay, that's probably what we should do.
You could
Figure a way
also-
to get real with the number.
Mr. Chair,
Senator McClellan?
someone also mentioned the pilot. You could put it in place with a sunset, or it's not exactly a reenactment clause, but say we're going to do it for this year, and then to move forward, the General Assembly will have to reenact it going forward, or some sort of.
We might want to just kind of fine tune it in the full committee if we
That's fine, too.
report it now, and then try to come up with a methodology to give us a little security with it. So we have a motion and seconded, I believe, to go ahead and report it. Any further discussion? Okay, all those in favor of recommending reporting the bill, that is Senate Bill 231, signify by saying aye. Aye. Any opposed? Okay.
Thank you. I appreciate your all's time and help with it. A question to Chair, how should I plan to proceed?
Well, I think you've got a win here. We're going to try to figure out how to
yes.
make it work.
All right, just let me know if and when I need to show up anywhere, and I appreciate your time.
We're not going to kill you, Bill. We're going to figure out how to
We
make
only
it
do
work.
it to your face.
Thank you. You're kinder than that co-chair he used to have. Thank you.
Okay. Senator Donovan.
Thank you, Mr. Chairman. I have, and members of the committee, I have Senate Bill 426 before you, and the substance of the bill is over on lines 195 to 198. And essentially, it is using, one of the greatest expenses we have is poorly controlled chronic disease. And often it results in frequent admission to the hospital or emergency room instead of maintenance treatment. And remote patient monitoring is really evolving and has been found to be very effective in this arena. And this just expands the scope of what is allowable for Medicaid reimbursement for remote monitoring, which would be preventing readmission or emergency treatment. And it would allow for asynchronous consultations. I think this is an old bill. Asynchronous consultations only when it is a pre-established relationship between patient and physician, and then provider-to-provider consultations. That's the substance of the bill. It is a recommendation from our telemedicine advisory board, and something that's been worked out. It's a surprise to me that it has a fiscal impact. The conversation that we had before session was that we thought it was going to be a savings. And so that is the challenge that we have going forward, is the fiscal impact that we're looking at.
Mr. Chairman,
Senator Evans.
could I ask what an asynchronous consultation is?
Yes. Thank you very much. Asynchronous consultation would be something that was recorded and then sent. And the best guidelines for telemedicine say that really it should be live. They're very specific definitions. And asynchronous can be used, say, for instance, you're an established patient, you might call and speak with somebody on the phone or leave a message and have something taken care of, but it requires that bona fide patient-physician relationship where there's been a physical exam, and you wouldn't want to have recorded messages going to a doctor you've never seen before or going to a provider you've never
So
seen.
your bill forbids that or limits that?
Limits asynchronous to pre-established patient
Relationships?
Yes, exactly,
Okay.
patient-physician relationships,
Thank
so
you.
that there is that bona fide examination.
Senator Dunn, but I agree. I don't understand why this wouldn't save money.
I know, and so that's my snag.
Right. Is there anyone else here to speak to the bill? Okay, I'm sure there would be no opposition to something.
Resounding support.
Mike, do you have any thoughts on that as far as those numbers?
Mr. Chair, only to mention that, I mean, certainly something like this could have savings. I mean, oftentimes you all see proposals in healthcare that has savings. The issue, I think, from a fiscal impact standpoint is if you're adding a service or some type of benefit, it's fairly straightforward to quantify that component to it, and that's typically what they do. So if, in this case, remote patient monitoring could lead to cost avoidance of healthcare services, that's harder to actually estimate. So typically, I can tell you my experience at DPB, we couldn't, I mean, that would commonly come up that people would want us to incorporate the savings. But the risk that you run is if you don't achieve the savings or you don't achieve the savings in the same budget period that you have the cost, then you run out of money. So it's hard to estimate cost avoidance savings, but it doesn't mean that, the bill won't generate savings. You can only see that over time as medical care costs might decline for that population.
Well, the notes here indicate that you would maybe 2% you would be avoiding inpatient of 68,000 people. That was what they projected, got their numbers. So they didn't incorporate the potential savings of not having inpatient service.
Right, because it's hard to quantify whether or not you avoid. You would have to look at, in that particular case, you would have to monitor the readmissions over time and see, maybe for a very specific population, just to see if it has an impact.
I was just going to say, Mr. Chair, I think this is something we should want to encourage. And I think I'd just like to make an observation that kind of budgeting is the very kind of budgeting that my teenagers utilize often, that hedging budgeting. They would never tell you that there was a savings. They would only ask for money. And so I think we should absolutely report the bill.
Okay. Is there a second?
Second.
Motion properly supported that we report the bill, that is Senate Bill 426, as referred to it from the Education Committee. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Thank you, Senator Donovan. We will recommend reporting that. Okay, I believe that cleared all our bills, and we have voices to present to us. Emily, good to have you here today.
Thank you for having me here today. Is this on? I know that I come at the end of a long agenda, so hopefully we can illustrate a little bit for you about the impacts of the pandemic on children and families in the Commonwealth. It's not a pretty story, but we do have some cute pictures, so hopefully that will make it a little bit easier. If you aren't familiar with Voices, we've been working with this committee for many years. We have been around for 25 years. We're an independent, bipartisan organization that works on multiple issues facing children and families. You heard from my colleague Allison already speak to some foster care initiatives. We also focus on family economic security, early childhood education, children's mental health, and health and wellness. Right now, we're very concerned about kids in the Commonwealth and how we move forward, both with more equitable opportunities and to address the pressing needs presented by the pandemic. We know your job is to make the money work, but behind the money is real lives. Babies getting a healthy start, kindergartners physically ready for school, and high school students navigating disruptions. Today we have recommendations focused on economic security, behavioral health, and wellness. I'm starting today on economic security because that often holds the key to a family's daily stability, including their physical and emotional health. Children are greatly impacted by material hardships created by economic insecurity, such as lack of food, housing, or health care. It can also lead to mental health challenges for parents, and a caregiver's emotional health can have an impact on how children, especially babies, grow and develop. There are two stories to tell about family economic security right now. First is prior to the pandemic, where Black, brown, and rural families were more likely to experience higher rates of economic security. These historically high levels in these communities have led to, among generations growing up with stress and instability. For you, that means that Black families, families of color, are disproportionately likely to receive public assistance for the programs that you determine the rules for, SNAP, TANF, and Medicaid. This chart from our data center shows the persistent rate of child poverty over the last 2 decades and the disparity by race. That last point is child poverty in 2019, just prior to the pandemic. The second point, a story around economic security, is parental stress, which has gone off the charts with worries about employment, families getting sick, children being safe. For nearly 2 years now, parental stress has been very high. With the last month of January and December, with the Omicron variant and more kids getting sick, it has continued to climb. This data comes from a nationwide study out of the University of Oregon called the Rapid EC Survey. So how do we provide some solutions that will help support family economic security? Number one, we ask you to improve access to childcare. Childcare helps families work, but is often more expensive than it could make sense to work, particularly with families have more than one children. 1 year of infant care is more than college tuition. Last year, you all improved eligibility for childcare by raising the income limits for families with children under 5 and allowing for eligibility during job search. The proposed budget would keep most of that in place, with an additional amendment from Senator Favola extends the income eligibility while increased federal funds are available. Since April of 2021, around 5,000 children have enrolled under the new criteria, and over 27,000 are currently receiving financial assistance. Additional federal funds from COVID relief have provided these resources. Solution number 2 is looking at financial assistance and public assistance. Traditionally, our poverty measure doesn't take into account what families might receive in terms of government assistance and transfers. So we look at this alternative measure of the supplemental poverty measure to better understand how those policies take shape. This estimate from Columbia University demonstrates when additional support has helped to buffer the economic uncertainty of the pandemic. Particularly helpful for families has been the monthly child tax credit payments, but those have just ended in December. While parents will get the balance in the spring when they file their taxes, the future is quite uncertain. Inflation continues, variants are swirling. The state can take action to smooth this out in 2 ways. First is to continue the work that you've done to increase the standard assistance for TANF. Our eligibility level is still incredibly low for families, and you have set yourself to be on a path to raise the standard of assistance by up to 50% of poverty. Senator McClellan has a budget amendment to increase that standard of assistance. And secondly, when you consider tax credits or tax refunds, it's that flexible cash right now that's directly to families that has been the most helpful. You can consider multiple options, but do consider what might benefit families. We're supporting the refundable earned income tax credit and the proposed budget amendments carried by Senator Barker and Senator McPike, as they will impact the most low-income families. Approximately 72% of those who file for the EITC have children in their households. This approach is the best one to target low-income families. Secondly, you all are considering some one-time assistance payments, which could be helpful to provide immediate relief. However, these are focused on the householder itself, whether they are a single household or a married household. This one single individual could get the same payment whether they had children or if they didn't. I would ask you to consider looking at these measures to target the lowest income families and consider number of dependents or household size when looking at these one-time relief payments. The second area that we've been very concerned about with children is in terms of their mental health. We've also known this issue has been lingering long before the pandemic, and now we're faced with a growing problem on already shaky ground. Our Virginia Youth Survey already saw concerns of increasing feelings of depression and anxiety in the high school population, particularly among girls and LGBTQ students, even before the pandemic. Now, with the pandemic, young people are experiencing what we call a collective trauma, shared experiences of disruption, grief, and loss. They may have lost loved ones or have their own health scares. They're having concerns among their friends and schools, long wait times to see providers, and a sharp increase of children who are finding the emergency room the only place where they can get their mental health needs met. Since you guys are the Money Committee, I did a little closer look at what you have spent on children's mental health in Virginia in the last budget cycle. I know there's many pieces of the behavioral health system, so this takes into consideration developmental services like the Part C early intervention services for children, as well as other sources in the mental health budget that are dedicated specifically to working with children. Out of the budget, which includes the DBHDS budget and the grants to localities for CSB, you currently fund less than 10% of that total budget to working with children. And when new initiatives roll out, as wasn't the case for alternative transportation, kids often are left in the second phase of help, so they don't always get help right away. So what can we do to help more children's mental health services? One solution that we're asking for this year is to better integrate mental health services into schools. You've done a great job over the last few years, particularly out of your education budget, to bring more school counselors and support staff into school. They're working hard to help students and put them on a path to graduation. But when it comes to diagnosing children with a mental health issue, creating a treatment plan, or providing treatment, they are not the most appropriate professionals, and families must turn elsewhere. Those clinical professionals may have long wait lists in the community or could be inaccessible due to insurance or transportation. To ensure that students have connections to a provider who can diagnose and treat conditions, as well as opportunity for more clinical services or brief interventions and assessments in schools, Senator McClellan is carrying an amendment to create a $10 million per year grant fund at DBHDS for school divisions to seek resources to pay for clinical services and partnerships with community-based providers. In addition to this integration pilot, we would like to see a work group, maybe at the Behavioral Health Commission or other school health commissions, identify strategies to pay for student mental health services, like pulling down Medicaid through the free care rule or the child's own health insurance coverage, and look at addressing difficult issues like the future of therapeutic day treatment in schools. We would like to see school personnel and students also be at those tables to help identify the solutions. Next solution is to invest in our entire mental health system. There's a lot of options on the table right now, but we pulled out Medicaid reimbursement rates as they are particularly key to meeting the needs of the most vulnerable children. So when you make investments moving forward, we hope that the workforce stays in the community and with our public providers, and that providers will accept Medicaid and serve more children. Finally, one area covers the sweet spot of economic security and mental health and wellness, and that is by passing some legislation to cover all kids, cover all of our immigrant children, all of the children in Virginia with health insurance. This is the simplest way to ensure that all children in Virginia are getting access to health care and mental health coverage. Senator McClellan has a legislation that will likely come before you, Senate Bill 484, that would create a state-funded initiative to provide health insurance coverage for immigrant children in our state. 10 other states have already taken this path, and we believe it would close the gap in a number of children who are currently uninsured in our state. Finally, at Voices, we cover a variety of issues, so there's a number of other issues that are under consideration this year. Mike will probably talk about them with some budget amendments coming in front of you, but we wanted to just raise attention to a few other issues that we believe could work across the board to help more children and families this year. So appreciate all of the work that you have done over the last few years to help children in our Commonwealth, and now more than ever is when we really need to meet this moment and help children. So I appreciate your support.
Very good. Questions for Emily? Okay, seeing no questions, thank you for the presentation, Emily, and thank you for all that you and your group do.
Thank you. Thank you, Senator Hanger. I'll leave some budget amendment materials for you too.
Okay, Mike, you want to run us through some proposed budget amendments?
Yeah, and Mr. Chairman and to the members of the subcommittee, don't worry. This is a brief, high-level overview.
Brief,
Yes,
okay.
yes. At best, 5 to 10 minutes. I'm not going to go line by line. I'm just going to give you the highlights. There are over 200 amendments, which is probably about 50% more than normal.
Yeah, it'd take 5
and-
minutes to read just mine, I think.
Yeah, it
Go
probably
ahead.
would. Yeah, I did not total them up by patron, so. But if you look at HHR, it's about $3 billion in request. But I'm going to give you the highlights. So behind tab 4, you will see the first sheet is just the caboose bill, Senate Bill 29. I won't go over them. It's just a few dollar amendments and language ones, but you can kind of glance at them there. On the next page, so Senate Bill 30, that has 6 pages. So I'll just go kind of briefly. There's everything from language and the Secretary's office to continuing to look. You remember last year, the aging work group, kind of look at aging services in the Commonwealth. Senator Mason has one to continue that. If you look under like CSA, there are items related to several more JLARC recommendations related to improving CSA oversight from their CSA study. So that includes like local admin costs and things like that. As well as several requests for the private day special education rate setting to sort of not proceed with that and to take the funds for that. In the Department of Health, there are things such as nursing scholarships that are noted from Senator Hashmi and Barker. There's a few of those. Amendments related to nursing facility staffing and standards administration. So that's Senator Barker has a bill related to that that's moving through the process. And you can just see kind of a whole variety of things. Some of them are pass-through grants, so like Special Olympics, funding for the health wagon. I will note near the bottom of that first page for health, Senator Pillion has an amendment that's state match for federal water program funds, $3 million the first year and $3.5 million. So the infrastructure bill that Congress just passed, the one part of it that touches HHR is there's additional money for drinking water, and his amendment actually represents the amount of general funds that the General Assembly will need to add to the budget in order to match those drinking water funds. So
Is it a 1-to-1?
I'd have to double check. I don't think it is, but I'll double check. And then right below that, you actually see 296-2G. That is the one amendment that the governor sent down in an executive amendment, which was to fix the issue in the Office of Drinking Water of $1.8 million per year. Moving to the next page, you see at the top there's the Department of Health Professions. Those tend to be non-general fund amendments, oftentimes related to legislation and stuff. Then moving to the next, the Department of Medical Assistance Services. Pretty much to summarize DMAS, this is about where $1.9 billion of the $3 billion is. It is dominated by provider rates. As you can imagine, the wage pressures, the labor shortages are pressuring virtually every, not just in Medicaid, but every healthcare provider. And so you certainly see that, even though there was substantial funds in the introduced budget for like DD waiver services, how that was done and how that was distributed across the different services, of course, was not equal. So that's an issue that you all will be looking at. But you can see it. It's a variety of things from dental, the dental fees to nursing facility rate improvements. There was one Senator Donovan to fully fund the Priority 1 wait list, but as we've talked about, one of the issues there is in the lack of providers. It's hard to kind of expand the wait list or to reduce it further than what's probably in the introduced budget. So you can see kind of there are language ones embedded in there as well that I won't go into detail at this point. So moving to page 3, it continues with DMAS. Again, you see additional rate increases. There's also the continuation of the 12.5%. Actually, Emily just kind of referenced that. So if you remember that through ARPA, there was the one-time savings for home and community-based waiver services that the state received, and we have to kind of reinvest those funds over 3 years. So one of the things that you all did was you provided a 12.5% increase for a full year for all home and community-based services. So that's broader than just the developmental disability waivers. That also includes the community behavioral health services and others as well. So that's one thing that wasn't continued in any way in the introduced budget. So that is an issue that you all will be evaluating as we go through that budget process. There's also everything from Senator Deeds adding 10 psychiatric residency slots. That's the residency program through Medicaid that came from the Joint Commission on Healthcare a few years ago that, Senator Barker has pushed very hard. So it would add to that. There's rate increases for Medicaid case management and things of that nature. Moving to behavioral health and developmental services, you'll see everything, language amendments and stuff like Senator Hanger has the plan to reduce state hospital admissions and to increase capacity. Moving to the next page, Emily had just mentioned Senator McClellan's amendments for the school-based mental health integration pilot. That's one of the larger requests for behavioral health. There's also a variety of amendments related to the developmental disability workforce to kind of continue to provide some efforts to kind of boost that workforce. There's also, as you've seen before, helping to fund the 20 behavioral health beds at Chesapeake Medical Center. Senator Sproul has introduced that. There's also kind of a new one that Senator Pillion has introduced for 3124S is to a public-private partnership to build a behavioral health facility down in Southwest. So he's actually asking for half the cost, $23 million to do that. Just to note kind of the variety of things that you see across these requests. There's also one related to this community-based behavioral health service gap innovation grant fund that was $50 million per year requested. There's two, Senator Hanger, Senator Deeds, they have the request for the Community Services Board. So that's one provider group that hasn't really received any direct support, but as you can see, of course, across the 40 CSBs, their request is $167 million general fund per year. So across all their employees, that is a big request.
Mr. Chair, I might suggest that in that need, there might be room for us to talk about controlling the admissions to the hospital. There might be some trade-offs involved.
Mm-hmm.
And then you'll see there's also requests additional funds for Marcus Alert implementation and, of course, continuing to convert more facilities to receiving centers. In aging, which is at the bottom of page 4 and into page 5, those you see, as y'all would recall, the typical ones for the Centers for Independent Living, the brain injury programs, you'll see those through there. There's also kind of a placeholder put in, and this bill will actually be before committee on Wednesday, is Senator McPike's bill, the JLARC recommendations for the Guardian Conservative Program. So that comes up on Wednesday. And so you can see a variety of things there. Senator Barker's request to kind of fully fund the long-term care ombudsman positions at DARS as well. Then moving on to DSS, a variety of things there from continue to increase the TANF standards of assistance. As you recall, actually, DSS has been directed to develop a plan to try to boost that to 50% of the federal poverty level over time. And this is kind of the next step in that process. They mentioned Senator Hashmi has a request to do a SNAP increase for the elderly. Of course, that would be a pure state-funded program. Separately to auxiliary grants, and quite a few related to different bills that you can see, as well as Senator Favola's that you already kind of heard, the foster care prevention program. And then moving to the last page, page 6, you can see some of the ones at the end, community action agencies, which you typically see from year to year, and other things where they're actually requesting TANF funds. And that's one thing that you all will be looking at through this process, as you've heard DSS indicating that we're near the point of running out of TANF, but we'll be looking at that. It's still a little bit off, but but the subcommittee will certainly take a look at that. And so pretty much that's kind of gives you the highlights. As you well know that through the budget process, you'll be going through every single one of these to see what y'all want to do, as well as everything in the introduced budget. So we'll probably be spending a lot of time together.
Right. I expect.
But with that, Mr. Chair, that concludes.
Thank you, Mike. Any member have anything additional to add at this point? Senator Eben?
Just wanted to point out that on page 3, item 311-2S, my budget amendment to preserve historic records at Central State Hospital, that's not intended to be a health issue. It's more a historic issue. I intended for it to go under historic resources. I don't know if it needs to be here or.
We can certainly look at that to figure out the best place. Okay. I mean, it will involve DBHS to some degree because the records are there on site, so they'll have to. We can definitely look at what is the best way to handle that.
The purpose is for history, not for helping people today who are there.
Right.
Thanks.
Got it.
Oh, yes. And we got to remember, Central State is being rebuilt. Well, slowly. They got a plan. It'll be a couple years yet, right?
Was that King Davis's thing on the historical part? Remember him? He was former head of what was then mental health.
Not sure. Sir Eben, is that something you're involved with as far as the historical documentation of it?
Is that King Davis's project?
Yeah, I think I know the name. It came to my attention from some people in my district, but I don't know him personally. Yes.
He used to be our commissioner. He used to be our commissioner. Great guy.
Okay. Okay, if that concludes our business, the committee will rise. Thank you. Thank you very much.
Thank you.
Thank you, Janet.